Good afternoon, everybody. Welcome to the 2021 National Conference. This is Advocacy 101, Your Voice Matters. My name is Amanda Woodson. I am the Government Relations Specialist with the Amputee Coalition. I am joined by the Government Relations Manager, Dustin Perchal. We are thrilled for you all to be here. So what is advocacy? Advocacy is using your voice to improve care for the limb loss and limb difference community. By sharing your story, you can build a relationship with your lawmaker that can advance legislation, improve policies, and change law to help millions of people living with limb loss and limb difference. Your story is powerful because you're the expert on living with limb loss and limb difference. You live the details every day. Who better than you to explain the issues facing our community? It's likely your lawmaker or their staff may not know much about the limb loss and limb difference community and the challenges you face. Your story brings those issues to life in a way a briefing memo never could. You give our community and our issues a face and name. To represent you, your lawmakers need to hear from you. They ran for office to serve their constituents like you. Your story matters to them. By telling your story, you can show them how they can help people living with limb loss and limb difference in their districts, their state, and across the country. You're probably thinking, but I'm just one voice. When we join our voices together as advocates, we can make big changes happen. Every one of our lead advocates will tell you how rewarding it is to advocate together, knowing you're making a difference for millions of people living with limb loss and limb difference. Advocacy Basics. Advocacy is as simple as telling your story. Sharing your story puts a very real face on abstract issues or legislation. Hearing your story helps your lawmakers understand how their votes affect the lives of their constituents, like you, living with limb loss and limb difference. To understand the crucial role you play, it can be helpful to understand how the legislative process works. So let's refresh your memory about how a bill becomes a law, how to think about engaging your lawmakers and ways to be the most effective when you do. Here's an image of the legislative process. I know it could look a little complicated, but we are here to help you navigate it all with us. Familiarity with the process will help you engage your lawmakers and their staff. The legislative process is the same whether you're engaging with your member of Congress in Washington, D.C., or your state legislator in your capital at home. For this exercise, we'll use an example of Congress. First, a bill is introduced in one or both chambers of the legislature. Congress has two chambers, the House of Representatives and the Senate. Next, it's assigned to the relevant committee or committees who oversee issues the legislation addresses. Then the bill is referred to specific subcommittees which has expertise in the issues. In our case, that is often a subcommittee focused on health issues. From there, the subcommittee decides whether to approve, amend, defeat, or table the legislation. Next, the bill goes through the same process before the full committee. After that, if the bill moves forward, either amended or in its original form, this legislation is considered by the full chamber. Then if both chambers, the House of Representatives and Senate, approve the legislation, it goes to a conference committee made up of members from both the House of Representatives and Senate, who work out the differences between the two pieces of legislation. After that, this final bill goes back to each chamber for a final vote. From there, if both chambers approve the final bill, it goes to the president or governor at the state level to sign or veto. Then if signed, the bill becomes law. If vetoed, it goes back to Congress, who has the opportunity to override the veto by a vote of 2/3 of the chamber. When you're engaging your lawmaker, it helps to know where they are in the legislative process. Is this a brand new piece of legislation? Is it being considered by a committee they sit on? Does the bill need co-sponsors to move forward? Knowing how the legislative process works helps you make your ask more precise and effective. Now that you're refreshed on the legislative process, what does it mean to be an advocate? Well, you don't need to be a government relations professional to be an advocate. You just need to be able to tell your story. As an advocate, you represent the Amputee Coalition and the limb loss and limb difference community. You become an advocate just by taking action with the Amputee Coalition. That can be as simple as responding to an action alert sent by the Amputee Coalition, or sending a letter or making a phone call to a member of Congress, letting them know why an issue is important to you. If you let your voice be heard by your lawmakers, you're an advocate. As you can see on the slide, there are dozens of ways to get involved and share your story. The common denominator is you. Bring your story and passion, and you will be successful. Lead advocates are advocacy volunteers who have gone through specific training about the issues facing the limb loss and limb difference community, our policy priorities, and skills to be effective advocates. Lead advocates build relationships with their senators and representatives, as well as their staff. To build those connections in different ways, by writing emails, picking up the phone, or visiting them in person when possible. By reaching out regularly and being a reliable resource of useful information, lead advocates create connections and educate policymakers about what it's like to live with limb loss and limb difference. Lead advocates don't work alone. The Amputee Coalition wants to have a lead advocate for all 435 congressional districts in 50 states across the country. But that's only a start. The more advocates and lead advocates we have working together in every state and district across the country, the more effective we'll be. Lead advocates help connect and coordinate advocates in their districts and states to be as effective as possible. Lead advocates also reach out to others in their network to take action with the Amputee Coalition. Do you have family, friends, or colleagues who have shared your journey with limb loss and limb difference? Do you know folks in your support group who can share their story? Or friends in other groups or organizations you belong to? Lead advocates make sure to amplify to the voices of those in their networks. By advocating with us, you can make sure your voice gets heard and help others get their voice heard too. Since we recently had an election and have a new Congress, new administration, and new lawmakers in state legislatures, you may be wondering, how do I know who my lawmakers are? Great question. And we have a resource for you. You can go to amputee-coalition.org/find-my-lawmaker, one word. Simply enter your zip code, then your full address. Any of the links that we are sharing in this presentation will be posted in the chat. You'll then be able to see a full list of your state and federal lawmakers. If you click on their names, you will see their profiles featuring contact information, including official social media accounts, personal, political, and staff information for each lawmaker is also available in separate tabs. Now that you know who your lawmakers are, you can start to plan engaging with them. Advocating to your lawmakers is about persuading them to take action. To persuade them, it helps to know their position on the issues. Remember, limb loss isn't partisan. We engage our lawmakers on policy, not politics. Here are a few things to consider as you prepare for your conversation with your lawmaker. What is their background? Do they have a personal connection to the limb loss, limb difference community? Have they engaged with our issues in the past? Maybe by co-sponsoring a piece of legislation. What committees do they serve on? Do they oversee our issues? Do you have a personal connection with them? Where do they stand on our issues? Are the lawmakers champions? Are they active champions of our legislation? Know a lot about our issues and are a leader for the limb loss and limb difference community? Or are they supporters? Have they supported these issues in the past by co-sponsoring legislation and would appreciate hearing about opportunities to help now? Or are they undecided? Are they undecided about an issue or piece of legislation? Maybe because they need to learn more. Or are they skeptical? Do they have questions or concerns about an issue or specific piece of legislation you can answer? Or are they an opponent? Do they vocally oppose your legislation or issue? Knowing where your lawmaker stands on our issues helps you be respectful, engaging, and effective. Building a relationship. Effective advocacy is about building a relationship with your lawmaker and their staff. It's about continuous engagement to create a connection throughout the year. Here are a few tips. Reach out when you have something to say. Is there a specific piece of legislation you'd like them to support? Or an issue coming before their committee soon? The Amputee Coalition will help you know when it's the right time to reach out on our issues. Let them know you're a constituent. Your elected officials are there to serve their constituents like you. Don't overdo it. Make sure you provide them with value when you connect. Remember that congressional offices are busy. They're working on lots of issues and at any given time. Always be positive, courteous, and as helpful as possible. The more they enjoy working with you, the more likely you will be able to accomplish your goals. As the old saying goes, you catch more flies with honey. Put a human face on the issue. Share your story. Explain how this issue or legislation affects real people like their constituents living with limb loss or limb difference. Say thank you. Always be sure to thank your lawmaker and their staff when you connect with them, especially when they take action on your issues. If you can thank them publicly for a job well done in an op-ed or letter to the editor of your local newspaper, even better. Your elected officials will appreciate it and remember. Before we move on to our next slide, are there any questions that you may have? You could put them in the Q&A section and we can answer them. But keep in mind also, we have another question and answer session at the end of this presentation. Advocating with the Amputee Coalition. Now that you have the tools to start advocating for yourself and the limb loss and limb difference community, let's discuss all the ways that you can advocate with the Amputee Coalition. Let's start with the Amplify webpage on the Amputee Coalition website. You can go directly to the website by typing in www.amputee-coalition.org/amplify yourself, which is on the slide. On this page, there are 6 tabs filled with information. I'll be discussing 2 tabs. The Amplify page has tons of tools to help you speak up, speak out, and not take no for an answer. The first tab I'll be discussing is the Share Your Story. One of the best ways to amplify your voice and the limb loss and limb difference community is by sharing your story. Your story is a way to educate the world about living with limb loss and limb difference. The story you share can be an everyday story, an example of the challenges of getting the devices or medical care you may need, or a dramatic success story. The Amputee Coalition respects your privacy and asks if you are sharing personal details, please keep in mind that these will be shared online. We will review the story and let you know when the story is posted. If you have any questions, email us at advocacy@amputee-coalition.org. The second tab is contacting your insurer. Have you experienced challenges with your insurance company when trying to access medically necessary prosthetic care? Have you been disappointed with your insurance company because of an inadequate coverage, denials, frustrating appeals process? Do you wish your state representatives would do more to support fair insurance coverage? This tab is designed to help you contact your insurer. The Amputee Coalition has created letters that you can use to contact your legislators or the CEO and medical director of your insurance company and make your voice heard. Together, we will amplify your voice by combining your story with thousands of others to make change happen. We've provided a list of companies that you can choose your insurance provider from. If you don't see your provider listed or have questions, please contact us at advocacy@amputee-coalition.org. Taking action with the Amputee Coalition. After learning about advocacy and the pivotal role advocates like you play, I want to discuss 3 ways you can begin taking action with the Amputee Coalition. The first way is registering to advocate with the Amputee Coalition. By registering, you will receive emails with information about advocating with us, such as our action alerts. The second way is registering to join our quarterly All Advocate calls. All our advocate calls allow us a chance to connect with you, discuss legislative priorities, and advocate to network with other advocates. Our next All Advocate call is October 7, 2021 at 3:30 p.m. Eastern Standard Time. I hope to see you all there. The third way is participating in our action alerts. One example of our action alerts is the letter to the editor alert. The letter to the editor alert is a way for you to share your story with policymakers in the world. One of the Amputee Coalition's legislative priorities is the Access to Assistive Technology and Devices for Americans Study Act, or AAA Study Act. This bill will direct the Government Accountability Office, or GAO, to produce a study that will identify the best care practices for people living with limb loss and limb difference, so they can be replicated across health systems such as Medicare, VA, and private insurers to improve outcomes for our community. Additionally, it will examine specific challenges such as how often individuals are denied coverage and outcomes such as whether patients can return to work. The conclusions from this study will help us craft new policy solutions to ensure quality care for those with limb loss and limb difference. This bipartisan bill was reintroduced in April during National Limb Loss and Limb Difference Awareness Month in both the Senate and the House. The Senate version was introduced by Senators Tammy Duckworth and Marsha Blackburn. The House version was introduced by Representatives G.K. Butterfield and Brett Guthrie. Our CEO and president, Mary Richards, yesterday during conference, introduced an action alert on AAA Study Act. This action alert asks your members of Congress to co-sponsor the AAA Study Act. Or if your member has already co-sponsored, it sends a thank you message. If you haven't taken action yet, please take action now. We also have a one-pager on the AAA Study Act that will give you a lot more information. This will also be posted in the chat. We've now reached our question and answer portion of the presentation. So any questions you may have, please use the question Q&A box. And if you don't get a chance to ask questions today, like my colleague Dustin Perchal said in the chat, please email us at advocacy@amputee-coalition.org.
Hey, and Amanda, it looks like we do have a couple of questions for you.
Okay.
One is the employment rate for individuals with disabilities across the country is double or close to double that of the national average. Will the ACA seek improvements to hiring regulations for IWD candidates? And I'm going to come off video just for real quick for this. And we know that October is a special month for employment for those with disabilities. And so I know we are focusing on that, and it's something we are looking into, and we have resources that we're doubling down with our resource center on. And so we are doing additional work on that and building resources in that area. So thank you for the question. And it is an issue that the Amputee Coalition does look into, and we do provide resources, and we are adding additional resources for that as well. And we happen to mark the month for October as well to note that as well. So thank you for the question. And we actually also have another question here. It says ADA regulations regarding accessible buildings. When will this regulation be updated? The last update was crafted and passed in 2010. And so with that, I mean, we know we just celebrated the anniversary of the Americans with Disabilities Act just back in July. And so I know it's a continuing thing that Congress looks at. Regulations can be fairly laborious as we go through, and Amanda is actually our resident policy analyst, and so she is the one that kind of takes a look at all of this. So Amanda, do you tell everyone about the research and things you do on all of our various issues, and this is one that we can look into, right?
This is absolutely what we can look into. The Amputee Coalition is becoming quickly a voice of the limb loss and limb difference community in Washington, D.C. We weigh in on a multitude of issues that affect the limb loss and limb difference community. We recently, in the last couple of months, sent a draft comment letter on Cures 2.0, which is a draft bill that should be introduced in the next couple of months that will be continuing and building on the work of the 21st Century Cures Act with creations of new institutes, funding, grants. So as of right now, I have heard nothing about updates being crafted or passed, but I definitely will be keeping an eye on that. And if we do end up weighing on this issue, we will be sure to let advocates know, because we want to keep things transparent.
Because we work in a lot of different coalitions as well. And I know right now in Congress, there's the infrastructure bill. And I know there were elements in there that may impact this as well. So we'll take this back and we'll look. I know there's a lot of questions right now about what will pass and what won't pass as we get through there. But we will take this back and we'll add it to our list, and we'll look in, seeing where we're at and where we can go with that. So we appreciate the question as it relates to that. So thank you so much for passing that along. I do see one more question that says TRICARE didn't seem to be included. They've worked well with Medicare in my case. So I wonder if that is in relation to the AAA Study Act. And what I would say is that that's actually where we are looking at TRICARE that would be included, that was as part of the VA and Veterans Affairs as well. So we'd look at VA and TRICARE as well for the AAA Study Act. All major insurers, that's what the Government Accountability Office would look at for that bill. So it would be really insightful to get that information to see where are people falling through the cracks, where are denials happening, where are people getting the care that they need, and what are those outcomes, so we can show policymakers, show them actual data. Right now, because we know that from what we've seen, that 2/3 of folks aren't getting the devices that they need, or a prosthetic device. And so we just need that real data, because there's a data lag right now. And so if we can get good, solid data and bring that to policymakers and say, look, here it is in black and white, provided by the Government Accountability Office, which is very trusted. It's bipartisan, nonpartisan, really. And that these offices, we can show this is an issue that we want to address. We can move forward with additional policy solutions. So that's really what the AAA Study Act is all about. This is the next step from a lot of the insurance things that we worked on in the past for the Amputee Coalition, to really highlight and show where we can do additional changes to policy to enhance the lives of the limb loss and limb difference community. All right, Amanda, I'll turn it over to you, because I think that is all the questions that we have.
So if you have any additional questions, please feel free to email us at advocacy@amputee-coalition.org, or come find us during the networking lounge. I know myself will be wandering around, so if you see me, please feel free to ask a question. Now that you know all about advocating with the Amputee Coalition, let's use our voices to improve care for the limb loss and limb difference community. For the 2.1 million Americans living with limb loss and limb difference, and the 28 more at risk to lose a limb, your voice matters. Together, we can make a difference.